Okay, welcome back dear Medicos. I am Dr. Kalim Raza. Today we are going to discuss about the vitamin B12. Vitamin B12, this is one of the most important B complex vitamin. It's not only important for your exam point of view, but it's also very important because of its deficiency around the world. You will see a lot of patients during your clinical life suffering from vitamin B12 deficiency, and deficiency of this vitamin may lead to the severe neuropathy, even combined degeneration of the spinal cord. So we have to understand that what are the sources of vitamin B12, how this vitamin is basically metabolized in your body, and what will be the consequences, complications in case of deficiency of the vitamin B12. So in short, this is one of the 5-star topic of the biochemistry, clinical biochemistry. When we are talking about fat soluble vitamins, we have just 4 fat soluble vitamins: vitamin A, vitamin D, vitamin E and vitamin K. So for digestion of the fat soluble vitamins, if you are taking sufficient vitamins in your diet, but still if you are having hepatobiliary disorders, a special disorder of the pancreas, and there is a deficiency of pancreatic enzymes, because pancreatic enzymes are necessary for the digestion of the fats, so it means you may suffer with a deficiency of the fat soluble vitamins. But still, if your hepatobiliary system is intact, pancreas is performing well, you are having malabsorption, that is another cause of the deficiency of the fat soluble vitamins. But when we are talking about water soluble vitamins, the case is a bit different. So let's suppose today we are going to discuss about vitamin B12, and first we will discuss the sources. The rich sources of vitamin B12 are the dairy products, red meat, especially the animal liver, fish. These are the rich sources of vitamin B12. And vitamin B12 is also called as cobalamin. This vitamin is also called as cobalamin. So when we are talking about sources, fish, dairy products, eggs, cheese, red meat, especially the animal liver, these are the rich sources of vitamin B12. And what are the important functions of the vitamin B12? Vitamin B12 basically help in the synthesis of the heme. So when we are talking about functions, most important function, synthesis of heme, and then also help in the, as a cofactor, helping in the formation of the DNA. So synthesis of DNA, synthesis of DNA. And then number 3, another very important function of vitamin B12 is the myelination of the nerves. Myelination of the nerves, synthesis of the heme, help in the synthesis of DNA, and also myelination of the nerves. These are the most important functions of the vitamin B12. Vitamin B12 is basically stored in your liver. And its storage basically primarily in liver, ये आपके लीवर में 5 से 7 साल तक स्टोर रह सकता है. बट इफ यू आर हैविंग नॉट sufficient diet rich in this vitamin B12, malnutrition, if you are vegetarian, you are not consuming meat or other dairy products in your daily meal, so this is a leading cause of vitamin B12 deficiency. विटामिन B12 की डाइजेशन अब्जॉर्प्शन के लिए आपको इंट्रिंसिक फैक्टर्स चाहिए होते हैं. इंट्रिंसिक फैक्टर्स which help in the absorption of the vitamin B12, these intrinsic factors are basically produced by the parietal cells of the stomach. So if you are having gastric ulcer or the gastric surgery, gastric bypass surgery, so ultimately there will be deficiency of the intrinsic factor. So if you are not producing intrinsic factors, it's mean you will suffer from deficiency of the vitamin B12. Number one cause I have told you, deficiency of the vitamin B12, if you are vegetarian. Number two is the gastric bypass surgery. Gastric bypass surgery may lead to decrease production of the intrinsic factors and there will be no absorption of the vitamin B12. Number 3, vitamin B12 is absorbed from the terminal ileum. So if you are having diseases relating to the colon ileum, if you have carcinoma of the ileum, iliac resection, or the diseases like Crohn's disease, inflammatory bowel diseases that specifically involve that part of your GIT from where vitamin B12 is absorbed. This is another cause of vitamin B12 deficiency. So number three is the terminal ileum diseases, because vitamin B12 is absorbed from the terminal ileum. Then next, a very famous tapeworm, Diphyllobothrium latum, which enters to your body when you are consuming raw fish. If you are taking raw fish in your diet, so raw fish basically also lead to deficiency of the vitamin B12. Why? Because of the tapeworm. That tapeworm is called as Diphyllobothrium latum. And then if you are having liver disorders, liver diseases, चूंकि vitamin B12 liver में store होता है, so if you are having chronic liver disease, it may lead to deficiency of the vitamin B12. So डाइट में आप vitamin B12 ले रहे हो, आप sufficient ले रहे हो डाइट में, but still you are having gastric diseases, gastric cancer, peptic ulcer और gastric bypass surgery, तो उसमें क्या है कि आपके parietal cells जो कि इंटैक्ट होने चाहिए, जहां से इंट्रिंसिक फैक्टर प्रोड्यूस होता है जो कि विटामिन B12 की अब्जॉर्प्शन में हेल्प करते हैं, तो फिर भी विटामिन B12 की डेफिशिएंसी हो सकती है. और गैस्ट्रिक फंक्शन ठीक है, अगर सोर्सेज भी ठीक है, आप डाइट में ले रहे हो, फिश ले रहे हो, मीट ले रहे हो, मिल्क ले रहे हो, बाकी चीजें ले रहे हो जो कि रिच सोर्सेज हैं विटामिन B12 का, लेकिन टर्मिनल इलियम का मसला है, स्टिल आपकी जो अब्जॉर्प्शन नहीं हो रही, यह भी विटामिन B12 की डेफिशिएंसी करवा सकता है. अब हम बात करेंगे कॉम्प्लिकेशंस क्या क्या हो सकते हैं. सो एज वी हैव डिस्कस्ड द फंक्शंस, दैट इट हेल्प इन द सिंथेसिस ऑफ द हीम रेड ब्लड सेल्स। तो क्या हो सकता है कि अगर इसकी डेफिशिएंसी होगी, इट मे लीड टू द एनीमिया। विच टाइप ऑफ एनीमिया? बेसिकली मैक्रोसिटिक मेगालोब्लास्टिक एनीमिया, नंबर 1। और क्या करवा सकता है डेफिशिएंसी ऑफ द विटामिन B12? इट मे लीड टू द कंबाइंड डीजनरेशन ऑफ द स्पाइनल कार्ड। कंबाइंड डीजनरेशन ऑफ द स्पाइनल कार्ड, जिसमें आपके डार्सल और लेटरल कॉलम डैमेज हो सकते हैं। वी हैव डिस्कस्ड in neuroanatomy about the function of the dorsal column also, and we have discussed the function of the lateral column, जिसमें क्या था, स्पाइनोथैलेमिक ट्रैक्ट और साथ कार्टिकोस्पाइनल ट्रैक्ट होता है। और अगर डार्सल कॉलम डैमेज हो जाएगा तो बहुत इंपॉर्टेंट सेंसेशन चली जाएंगी। उसमें वाइब्रेशन था, प्रॉप्रियोसेप्शन था, स्ट्रियोग्नोसिस था। और अगर लेटरल कॉलम डैमेज हो रहा है तो उसमें पेन और टेम्परेचर की सेंसेशंस कम हो जाएंगी। और उसके बाद चूंकि कार्टिकोस्पाइनल ट्रैक्ट भी पास करता है, so patient will have multiple symptoms in case of the subacute combined degeneration of the spinal cord. Neuropathic symptoms होंगी, a group of neuropathic symptoms. Patient will have symptoms of tingling, burning sensation of the hand and feet, numbness, weakness. And if there is a prolonged deficiency, अगर prolonged deficiency होगी विटामिन B12 की, then it may lead to irreversible nerve damage. So again, please, we will recall the complications in case of the deficiency of the vitamin B12. Number 1, anemia, macrocytic megaloblastic anemia. Then it may lead to subacute combined degeneration of the spinal cord, and then prolonged deficiency may lead to irreversible nerve injury. I hope you understood the journal review of vitamin B12 sources, its important functions, and the complications in case of the deficiency of the vitamin B12. Take care. See you in next video lecture. Thank you very much.